You're starting placement in a few weeks or a few days, and suddenly the nerves hit. Am I prepared enough? I don't know what to bring with me. I don't know what I'm allowed to wear. All of that. In this video, I'll mention everything that you need to prepare beforehand, like what you need to pack in your bag, the outfits you can wear, what you need to buy beforehand, and even just how to recap the content beforehand. So this is going to be your A to Z guide to starting med school placements. Hello everyone, I'm Alaa, I'm a fourth year med student, and if you're interested in this video and would like to get more of an insight of the life of a med student or the life of a student in London, the chronicles of med school, and tips and tricks here and there into productivity or time management, then make sure you subscribe and press the notification button. Now without any further ado, let's get started. Okay, now the first section, and I would argue the most important section, is the Itty Bitty bag essentials. What do you need to bring in your bag? What should you pack? This section is very important, and you end up making use of the things that we're going to pack in the bag literally every hour in your placement, every day, every hour. And if you miss one of them, then it's genuinely so bothersome. Now, the first thing that you need: pens, and ideally multiple pens and cheap ones. You will lose them. Also make sure that they're black ink, because don't make the rookie mistake that I did, which is I got a blue inked pen and I filled out a bloods sheet with it and a blood bottle form with it. That is apparently a no-no in hospitals, and they always use black ink because that's what's read by the scanner machine or whatever they use to read the forms. They only pick up black ink. So they will tell you off, and they did tell me off for that. The other thing is a small notebook. This is for when you want to look busy in front of the consultants, and it's the best tip ever. I just need confirmation that people do this as well. Please let me know, because I'm constantly scribbling on my notebook to look like I'm busy. Just scribble everything that they say onto the notebook, and when there's something new that you've actually learned, it's handy to have the notebook so that you can write it down and recap it later on. Also, this is a lifesaver when you're taking a patient's history and you keep forgetting it, so you can't do the handover to the consultant or to the registrar. So this is a lifesaver. Third thing is a pen torch. So this is actually quite useful. Usually you can get it in Freshers Fair at any one of the society stores. Maybe check out your ophthalmology society or one of the medical student insurances. They usually have pen torches, and they're really difficult to find on placement sometimes, so it's nice to have it handy when needed, especially during your clinical skills teaching sessions as well. Next thing is a water bottle. This one's very, very important, and you have to either get a cheap one or one with a strap. You might lose it, and I've lost my water bottle before. It's really sad, so please be very careful with your water bottles. The other thing, and this is something that I always forget and I regret it every single time, keep a power bank in your bag ready for when and not if your phone loses charge. For some reasons, our phones are meant to be amazing, the next generation, whatever they call it, they do not last the whole day of placement. For some reason, I don't know why. I got a new phone and it still doesn't last sometimes. So a power bank is very, very important. You don't want to be in the position where you're just jumping around asking people if they have a charger, or jumping around with your charger looking for a power socket. That is not the way to go. The other thing, and this one is actually really important as well, a moisturizer for your poor hands that will face the hand sanitizer and hand wash more than 10 times a day, especially if you have a surgery placement. And even if you have a wards placement like rest ward, you are washing your hands constantly. You're using hand sanitizer constantly. So it is a nightmare for your poor hands. So get a good moisturizer. You need your snacks to keep you alive and standing upright and not on the floor. I get hungry really quickly. A lot of the times, if you're on a ward round and it starts at, like, let's say at 9, with a handover being at 8:30 or at 9, the ward round, especially if you're on a medicine ward, will last all the way until 12. And I've had ward rounds lasting until 1 as well. The other thing is now, and the main star of the show, is your stethoscope, which I'm sure you're very, very excited to use by now if you're just starting placements. So before placements, I would have said in preclinical years, you don't really need to have one. But now that you're starting placements, it's quite important to have one. It doesn't have to be a Littmann or something fancy, just a working stethoscope for you to practice listening to murmurs or breathing sounds, etc. Also, a lot of the consultants get disappointed if you don't have a stethoscope, and they're not really that keen on handing their stethoscopes to students either. They're usually very fancy stethoscopes, so that is also for your rep as a student. I think try and always get your stethoscope with you. Okay, now that we've gone through the Itty Bitty bag essentials, so now you have your bag ready. This is the bag that I like to carry around with me in med school. I got this as a gift from my cousin actually, so thank you very much. And it's a really nice bag. It's sturdy. In placement, if you're carrying your iPad, your devices, your notebooks, it gets really heavy. And to be honest, I did it in first and second year. I sacrificed my shoulders. I will not be sacrificing my shoulders anymore. So it's going to be a backpack for me. And that's all you need in your bag, essentially. Okay, now moving on to the next section, which is the formal attire. Some consultants tend to be quite strict about formal attire, so it's always better to be on the safe side with what you're wearing, or just go for the good old scrubs. I've seen multiple people in my year getting kicked out for what they wore to placement. So I think this section is quite important, just so that you know what to wear, you know what's socially acceptable in a hospital, and what consultants are most likely not going to comment on. I'm also going to be putting on photos of this app that I'm using now. So this app is called Index, and essentially I've just taken a photo of all of my clothing items. I don't know if you can see here. So these are all my clothing items. I literally laid every single one out on my bed and took a photo of them, and then you can make your own outfits like this. Essentially what you need to have 1 or 2 plain trousers or a long skirt, black, and 1 basic color like gray or beige usually is going to suffice you. Make sure that the skirt is long, okay? I've never seen anyone get away with wearing a skirt over the knees. Get 1 or 2 formal looking shirts to pair with your trousers. So if you're having black trousers, you can get any type of shirt. You can get one of those satin formal shirts. You can get a cotton shirt, whatever you find it works out. You can get a fitted shirt, a loose shirt. I've seen a lot of people just pair a nice t-shirt, like a nice formal-ish t-shirt with black trousers. Now, in terms of what you're not allowed to wear, and I think this is the most important section, because there's a lot that you're allowed to wear, but there's a red line to what you can wear to placement. So obviously no shorts of any form. I've never seen any consultants or any regs or any F1s, F2s wear shorts, so stay away from those. No short skirts, as I mentioned, so always try and make sure that it's under the knees, or maxi preferably. No shirts that show any skin in terms of your waist or your midline. I've seen a girl get kicked out because she was wearing a shirt that was quite cropped, so that is going to get you kicked out. And I've seen another girl that was, a doctor commented, they didn't kick her out of the ward, but they just commented saying that this is not appropriate outfit for a ward. So I think that's quite common sense, so just make sure you don't wear cropped shirts. Obviously no jeans. Cargos, you can get away with cargos if they look sort of formal-ish. And if they don't look formal, if they look very like jogger style, then I'd say avoid wearing them. Trainers, completely allowed. Don't worry about trainers. No one cares about what you're wearing for your shoes, as long as it's something comfortable that you can wear for a long period of time. I've seen loads of people just wear good old black trainers, so go for that, or any other comfy shoes that you have. The other thing is make sure that whatever you wear, whatever top you wear, you can easily pull up the arms. So you have to be bare below the elbows in wards, and a lot of the nurses do keep an eye on this. The final thing as well, jewelry. You're only allowed wedding bands, I believe. Aside from that, no rings are allowed, no watches, nothing. Essentially just make sure that you're bare below the elbow. I like to wear my rings on the way to placement, put them in my pocket afterwards, and then as I'm leaving I wear them. Another pro tip is to have your outfit ready the night before placement. So I've been starting to do this, and I really like this. I would just hang my outfit, like you can see my wardrobes, they have those doorknobs, so I would just hang my outfits on them. Another thing as well is if your uni has scrubs, then you can make use of those scrubs. So technically, according to guidelines, if you wear scrubs that you bring from home, you're meant to wash them at 60 degrees, I believe, every night. So make sure that you do that. Make sure you have multiple pairs of scrubs that you can alternate with, and that's something that you can do as well. And then last but not least, in terms of the outfit section, this is something that I have yet to do: compression socks. Compression socks are really nice, especially if you're doing a medical ward, for example, and you're standing for long periods of time on your ward rounds. You end up moving anyways on the ward round, so you don't actually need compression socks, but I've heard that they help people, they're like more comfortable to stand in, so that might be a shout as well. I'll try it out and let you know as well. If I do end up buying one, I'll try it out. So that's it for our formal attire. Hopefully you can see that this is really simple. You don't have to overthink what you're wearing at all. As long as you're just not going for jeans, you're not going for something very revealing, they're not going to kick you out. So don't worry about it. It's quite simple, and make sure you wear comfy shoes. Now let's move on to our 2 other sections. The first one being the weekend before. So the weekend before you start your placement, what do you do? How do you prep? So what I would recommend you do is you go through, so let's say you have cardio, for example, for your first week of placement. Go through some of the high yield topics that you would see in cardio. Things like, for example, ALS guidelines, they might ask you about it. SVTs, so tachycardias, the different types of tachycardias, the different types of bradycardias. So go through the high yield topics, you can skim over the notes. There's so many different websites that you can find online, like Geeky Medics. You have the nice guidelines. You have videos online as well that you can watch. For example, Ninja Nerd. You can go through your own lectures or your own Anki, or for example, PassMed. PassMed, I would 100% recommend, especially for clinical years. Use the high yield textbook. It's amazing. So that has everything essentially that you need to know in terms of our level, so 3rd clinical years, 4th year, 5th year. And then I would recommend over the weekend, don't get too stressed about going through everything, and then you're not going to end up remembering everything. You spent a lot of time just learning a lot of niche stuff, and then the next day you would have forgotten everything, and the consultant's going to ask you a question, you're going to be like, I don't know. So moving on from this weekend before, I just wanted to have a small section about reality versus expectations in placement. So first expectation sort of is that, oh, they're going to grill me with questions, and reality of this is actually most consultants and reggers do not care about students. Unfortunately, that is a real case scenario in the UK especially. They just do not care about students. You're going to be in the ward rounds, and most of the time you're not going to be addressed at all. You're going to have to put in the effort to learn or to ask questions. Unfortunately, that is a reality of placements. You're really going to have to put in the effort to be noticed. I mean, sure, I've had experiences in placement where the F1s and F2s were amazingly nice and they got us involved in a lot of stuff. Or I've had experiences where the consultants were really nice and they asked us questions, but in a very nice teaching way, and they taught us. But don't be surprised if you see the complete opposite. And I would say I've only had potentially just one consultant who would grill us, and this consultant, I kind of loved her, but she essentially we came to her ward round one time and she looked at us and she was like, what patients do you know from this ward round? And we usually went to the other consultant's ward round, so we hadn't actually looked at her patients. So we're like, oh, we're not really sure. I mean, I think I've seen this patient. And she literally looked at us and she was like, you're not going to benefit from this ward round. And after that, she did not address us, not once. She did not look at us, not once. So we just excuse ourselves. And then next ward round, obviously I came in early, prepped myself with the patients and everything, and she was really happy to teach us then. So you might see experiences like this, but reality is most of the time they're too busy to care. So don't worry too much about this. Now, the other expectation is that I'm going to come in, I'm going to get so many clinical skills done, I'm going to have loads of experience taking bloods, loads of experience doing cannulas, I'm going to do ABGs, it's just going to be really easy to get my sign-offs, etc. Unfortunately, once again, the harsh reality says otherwise. A lot of the time, you're going to be running after clinical skills, especially bloods. Unfortunately, especially bloods, the phlebotomists come in at 7 a.m. in the morning, they get all the bloods done, and you're left with literally nothing. I want someone to take bloods from. There's no one to take bloods from. Unless they have a difficult blood, which then you're very welcome to try. And it's really nice actually trying a difficult blood and getting it, so that's quite a nice thing to do. Most of the time you really have to run after these opportunities. I would say the one thing that you can get is cannulas. So cannulas, the benefit of them is that if you go to any outpatient clinic, for example, like endoscopy, if patients are coming in for endoscopies, most of them do get cannulas. So you can just go to that center and ask the nurses. The nurses are usually very nice there, and they're very, very skilled at cannulas. So that's an amazing way to get cannulas. So you can get cannulas done. The other skill that I actually have yet to have a go at, which is really unfortunate, and I really want to do it in this placement, is a catheter. So getting catheters as well, you have to be vocal about it. You have to say, I want to get a catheter done. I would say my biggest advice with this one, reality expectation thing, is to really sit down and have a timetable of what you want to get done. So with every day, say, I want to get this skill done, I want to get this skill done. If you come in just waiting for things to happen, they're not really going to go your way. So you have to come in with an intention and then go to the nurses, tell them, I want to do this, befriend the nurses, they're always really, really nice. Other thing is expectation, oh, I'm going to have to come in from 9 to 5 and I'm not going to have any time for my life, and that's it. This is 9 to 5 every day, Monday to Friday. Nah, don't worry about it. You do not need to. So the reality is you can leave after the ward round. You can come in later than the ward round. So after the ward round, instead of coming in for 9, it's up to you. It's quite flexible. Most unis, I would say, are quite flexible, unless you have a timetable, which I would say is amazing actually to have a timetable. But a lot of the time you can manage your time well and decide that I'm going to leave after lunch to get studying done. So make sure you're not overbooking yourself with placement, because remember, you still have your exams, you still have your OSCEs that you need to pass. The aim of this year is to gain experience and pass your exams. It's not to work as an F1 in a placement. Okay, so we've done the weekend before. Now let's move on to the night before placement. So the night before, first thing you need to do, check your timetable, check your route to the hospital, check there's no strikes, and just know when you have to leave. You don't want to be late on your first day. See what you have allocated. If you have induction, make sure you're there for it. And just in general, just prepare yourself for the day. Download any apps that you need to download for placement. So I would recommend, in terms of apps, the BNF guidelines. So the BNF app is for any medications and stuff like that, and you'll notice that the F1s, F2s, the regs all check it. We also have, for example, a hospital guidelines app. So for St. Bartholomew's Hospital and Royal London Hospital, etc., we have an app called YOLAS. I'm not sure if I'm saying that right, but YOLAS is essentially an app for the guidelines of this hospital and of this Bart's Trust. Also, if you have an app that you need for signing in for your attendance, so for example, we have our uni app that we sign in from online and it just detects the location. I also like to have the PassMed app on my phone as well, so I can check the high yield textbook whenever. The other app that's also really good is the MD Calc app, so MD Calculator. And it just has, the MD Calc app essentially has any calculations or any sort of formulas that are used in medicine. It has so many equations. It has creatinine clearance, MAP, the risk score for AFib. So essentially you just scroll down, it has so many different scores. So these are the apps I would recommend you download the night before. And then pack your lunch. Top tip, make sure you pack your lunch the night before. I always tell myself, it's fine, I'm gonna wake up and make my lunch in the morning. I always run out of time. I am notorious for my bad time management. It's getting way better, to be honest. I won't arrive there more than 5 minutes late, but it's always just leaving the house is for me such a rush. And so things like that, I will always, if I tell myself I'm gonna pack lunch tomorrow, it's not gonna happen and I'm just gonna have to buy lunch. So try and pack your lunch the night before, make a quick pasta, make a quick sandwich, whatever it is, just pack it beforehand. And then last but not least, set many, many alarms. If you're someone who struggles to wake up in the morning with alarms, then make sure you set loads of alarms. And this is where I actually really want to mention an app that I've been using lately that I've just adored for alarms. And this is not sponsored as well. So the app is called Alarmy. So this is the app here. And essentially you would have an alarm and you can set a mission that you have to complete in order to turn off the alarm. So my mission is a math equation, for example. And as you can see here, you have loads of missions like a tap challenge, typing, math, etc. So mine is a math challenge and this is my challenge. It's level hard, and because I've been using it for a while now, I use it to wake up for Fajr, to wake up for prayers, and then just to wake up early in general. Because I've been doing it for a while, I went from 3 times to 4 times because I've noticed that my brain is getting more used to it. But it's an amazing app in general, so I definitely recommend it for alarms. Okay, so that's it for getting ready for placement. That is everything you sort of need to know about getting ready for placement. And having said all of this, it does feel like a lot, but generally you do get in the routine. After the first day, you're going to know straight away what the vibe is, what you're meant to get with you. So everything that you're going to learn about that is common, you do see it multiple times on placement, and it's really nice to see in a kind of educational way. And when you get asked questions on it, you will have already covered the content. That is it for getting ready for placement and everything you need to know from A to Z to getting ready for placement. If you have any other tips that you've tried and that have worked for you, please comment them down below. I would love to find out how to up my placement game and what has worked for other people. And if you have any questions, comment them down below. If you've enjoyed this video, please make sure to like and subscribe, and I'll see you in the next video. Bye bye.